What can Britney Spears teach us about healthcare? Britney Spears, born December 2nd, 1981, is an American pop artist whose first two studio albums became two of the best-selling albums of all time, along with making her the best-selling teenage artist of all time by early 2000s. In 2008, Ms. Spears was twice taken to a hospital by ambulance for involuntary psychiatric evaluations amid a series of public struggles and concerns around her mental health and substance abuse. Soon after, a court in California appointed Ms. Spears' estranged father, James P. Spears, as the conservator of her assets. As reimbursement for acting as a conservator, James Spears got a portion of all Ms. Spears' earnings. Further, Ms. Spears was denied her choice of counsel and provided a court-appointed lawyer, Samuel D. Ingham III. Mr. Ingham was also to be paid from Ms. Spears' assets, as are the lawyers who are arguing to keep Ms. Spears in continued conservatorship. Britney Spears did try to improve some facets of the conservatorship, such as having her father, James Spears, removed as the sole conservator. 13 years later, Ms. Spears is still not in direct control of her earnings and assets, even as she has turned 39 years old and earns millions of dollars annually from her performances in Las Vegas. Other sordid details of the arrangement have now also come to light. Apparently, Ms. Spears was never advised by her own lawyer, Mr. Ingham, for years that she could appeal the courts to have the conservatorship terminated. Termination of the conservatorship would have potentially allowed Ms. Spears to fire Mr. Ingham. Ms. Spears further alleged that she was overworked without any breaks, medicated with lithium, and prohibited from having more children after her conservatives did not allow her to remove her birth control device. Decisions, she said, were approved by her father and co-conservator Jamie Spears. The least we can do about this sorry situation is to learn the right lessons from it. First, it should be very apparent that designing a system that will take care of a person better than the person themselves is so hard as to be considered impossible. Of course, if we searched extensively, we could find a few people so cognitively impaired as to benefit from a brief conservatorship. But the overwhelming majority of Americans do not fall into this category. Second, note how difficult it is to find people as conservatives who will actually do the right thing in all instances without regards to their personal benefit. Again, virtually impossible. Unfortunately, the American healthcare system has been a de facto conservatorship on all Americans for the last 60 years. The conservatorship starts with the confiscation of the earned income of all Americans. A portion of our income is either taxed away outright for healthcare or withheld by our employers as insurance premiums. Even if you decline your employer-sponsored insurance, you will not get your money as additional income. It will be subjected to an 8% payroll employer tax, 4% unemployment insurance, 8% employee payroll tax, state income tax, and finally, federal income tax. For every $100 in insurance premiums declined, most Americans will see under $50 in their hands after all the taxes. No wonder Americans choose to give their money to the conservatives. What follows is precisely how a conservatorship is expected to proceed. Every participant in the system professes their goal to improve patient and safety outcomes cost-effectively. All the while, our conservatives are employing a greater and greater number of people and negotiating higher and higher payments with healthcare providers with increasing cost to the consumer, leaving the consumers feeling exactly as Ms. Spears has felt: angry, sad, depressed, and unable to sleep at night. Being born into this conservatorship, our generation has made the same mistake that Britney Spears did, to try and improve the conditions of our conservatorship. We have passed legislation to mandate coverage of pre-existing conditions. We have subsidized health insurance premiums. We have limited the profits that health insurance companies can make. We have mandated hospitals to use electronic health records. And finally, now there is a growing movement to have a Medicare for all system take over. But, just like Britney, we don't realize that the conservatorship needs to end. If you like our content, don't forget to share, like, and subscribe.